Police are considering taking legal action against the parents of young protesters who vandalized public property during recent protests in Bangkok. Metropolitan Police Deputy Commissioner Police Major General Tawichai said that several of the suspected vandals are teenagers and some had previously been arrested for similar offenses, adding that this is the reason police are considering the filing of criminal charges against their parents for their failure to restrain their children in accordance with the child protection law. 13 protesters are in police custody in connection with the violent protest at Dindang intersection and at the Victory Monument yesterday. Several motorcycles were also confiscated. Hardcore protesters fought running street battles with crowd control police yesterday and the day before at the Victory Monument and Dindang intersection. The protest yesterday was organized by the Talufa group, while the one on Tuesday was led by the United Front of Thammasat and Demonstration Group. Both are closely connected with the anti-establishment Rasadon group. Police Major General Piya said that 8 police officers were injured yesterday, mostly by shrapnel from flares and giant firecrackers allegedly hurled at the police by some protesters, adding that 2 of the injured had allegedly been assaulted by protesters. He expressed regret over one protester who sustained serious injuries when a giant firecracker accidentally went off on his hand. Last night, forensic officers examined property allegedly damaged by protesters to search for evidence. A police truck parked under the Dindang Expressway was set ablaze and 2 police booths at Rajtewi and Patumwan intersections were damaged and an air conditioner was smashed. Several traffic control panels were also vandalized. A police officer told Thai PBS reporters that a gang of motorcyclists arrived at the police booth, dismounted and started to attack it, claiming that they intended to incite unrest. Prime Minister Prayut Chan-o-cha should exercise his powers under the National Security Act to force Siam Bioscience, the local producer of the AstraZeneca vaccine, to suspend the export of the vaccine for 3 months and use those doses domestically instead to contain the accelerating spread of COVID-19 infections in the country. Dr. Manu Lee Chaweng-wong, a specialist in respiratory diseases at Wichayut Hospital, pointed out that no lockdown measures, no matter how rigid they are, will stop the spread of the contagion because home has become the main breeding ground for the disease, as he suggests that the lockdown restrictions should be eased to allow some businesses to resume operations before the economy suffers even more damage. He predicted that in the next 100 days, half of Thailand's nearly 70 million population may be infected and the daily death toll may climb as high as 30,000 unless 40 to 45 million Thais are vaccinated in the next 100 days, or 500,000 people per day. Citing the 87% of efficacy of AstraZeneca in preventing death from the Delta variant as reported in Canada, Dr. Munun said the only way to solve the shortage of vaccine in Thailand is to stop its export, as previously proposed by another doctor, Professor Dr. Prasert Warakul of the Faculty of Medicine at Sirirat Hospital. He said that earlier efforts by the government to convince AstraZeneca Thailand to supply more doses for domestic use have failed, blaming the government's errors in vaccine procurement and management. Noting that Siam Bioscience is producing 10 to 15 million doses of AstraZeneca viral vector vaccine each month, Dr. Munun said that if those doses could be diverted for domestic use for 3 months, Thailand would have a good chance of reducing the death toll from COVID-19 by as much as 80% and reduce the number of patients in hospitals substantially. Even though banning the export of the vaccine will affect other countries in the region, which are contracted to receive it, he said that this is an approach which Thailand must take, and he believes other countries would do the same if they were in the same situation. However, one obstacle to his approach is that Siam Bioscience, although a fully Thai-owned company, is just a production unit of AstraZeneca Thailand, not the owner of the vaccine it produces. About 2,000 pharmacies have joined Bangkok's home isolation program, under which they will provide antigen test kits, medication, and counseling to asymptomatic, mildly symptomatic COVID-19 patients and those in high-risk groups. Dr. Jirapon Limpananont, president of the Council of Pharmacy of Thailand, said they have sought cooperation from pharmacies in the capital to help in the operation of the home isolation program. With the pending arrival of the antigen test kits purchased by the National Health Security Office through the government pharmaceutical organization, she said that the council decided to mobilize the support of pharmacies through which the antigen test kits will be distributed free of charge to the public, including to those in home isolation. Instead of these people having to obtain medication or antigen test kits at the pharmacies, which will risk the spread of the disease, she said pharmacies will be responsible for the distribution of the test kits, medication, and counseling. The names and phone numbers of participating pharmacies will be published so those in home isolation can make contact to seek advice and obtain the antigen test kits or medication from the pharmacy of their choice. Dr. Jirapon said that for people who are at risk of infection due to their close contact with the infected and who are in home isolation as a precaution, the pharmacists will assess and provide advice on how to look after themselves while in isolation. When home isolation is not possible, the pharmacies will try to arrange for community isolation facilities to accommodate them. The antigen test kits are expected to arrive within a fortnight and will be distributed as quickly as possible.